Welcome to the deep dive. Imagine for a moment the incredible feat of a mare giving birth. It's a moment of wonder, often seamless, but, even after a successful delivery, new challenges can emerge for our equine friends. Today, we're diving deep into one such critical challenge, equine postpartum metritis. Our mission on this deep dive is to take a stack of specialized sources. We've got everything from a specialist-level study guide to an overview on equine reproductive health and treatment. And we're going to unearth the truly critical insights about this condition. Our goal is to equip you, our listener, with a thorough yet digestible understanding, hopefully providing those genuine aha moments without the information overload. You'll walk away not just informed, but genuinely enlightened.
Exactly. And this isn't just about a single mare's health, as crucial as that is. When we talk about equine postpartum metritis, we're discussing a condition that has a substantial ripple effect across the entire equine industry. Think of it this way. A single severe case can not only endanger a mare's life, but also disrupt an entire breeding season. That potentially cost breeders tens of thousands of dollars in lost foals and extensive veterinary care. It's a silent economic drain, making understanding it absolutely paramount.
Okay, let's unpack this then. At its core, equine postpartum metritis is an inflammation of the uterus that occurs after a mare has foaled, and it's most often triggered by a bacterial infection. That sounds straightforward, but the implications are anything but simple.
Precisely. This inflammation is a leading cause of infertility in mares, which directly translates to those significant economic losses we just touched on. It's an urgent issue that veterinarians and horse owners alike need to be acutely aware of because, well, early recognition can make all the difference.
And it doesn't just happen randomly, right? There are very specific factors that can significantly increase a mare's risk. We're talking about things like dystocia, which means a difficult or prolonged birth, where retained fetal membranes, that's when the placenta doesn't come out completely after foaling.
Yes, exactly.
Uterine trauma during foaling, maybe poor hygiene during foaling assistance, and even placentitis during gestation. An inflammation of the placenta before birth can all set the stage.
Absolutely. And there are also factors related to the mare herself, like a suppressed immune system, maybe a genetic predisposition, sometimes informally called dirty mare syndrome.
Okay.
And parity, meaning mares who have had multiple previous pregnancies, seem to be at higher risk sometimes.
If we connect this to the bigger picture, the underlying pathophysiology, what's actually happening inside?
Well, it's quite intricate. What happens is that when bacteria colonize the uterus, it triggers this intense inflammatory response. You get edema, that's swelling, hyperintemia, which is increased blood flow, and leukocyte infiltration, basically a rush of white blood cells trying to fight the infection.
Okay.
Now, this whole process, this battle, actually impairs uterine involution.
Which is the normal shrinking back process.
Exactly, the crucial shrinking and healing of the uterus after birth. And what's truly crucial to grasp here isn't just that bacteria cause inflammation, but that this specific inflammation can almost paralyze the uterus, preventing it from naturally cleaning itself out.
So it traps the infection.
Precisely. It's like the body's own defense mechanism inadvertently turns against it. This impaired contractility, in severe cases, allows the accumulation and absorption of debris, bacteria, and their toxins. That can potentially lead to dangerous systemic effects like septicemia, a widespread bacterial infection, and endotoxemia, where bacterial toxins spread throughout the body, causing a full-body inflammatory response. Very serious stuff.
So it's clear that metritis isn't just one thing. It presents in different forms, each with its own characteristics, which I imagine makes diagnosis tricky.
Indeed. We classify it into a few key types, and understanding the differences is vital for treatment. First, there's acute puerperal metritis, or APM.
Okay.
This is the most severe form, typically seen within hours to a few days postpartum, often with clear systemic signs affecting the whole body. It's strongly associated with the heavily contaminated uterine environment, those retained fetal membranes we mentioned, or a difficult birth.
The really acute, sudden onset kind.
Exactly. Then we have subacute or chronic metritis. This develops days to weeks after foaling. It might have less severe systemic signs, but it's marked by persistent uterine discharge and, crucially, ongoing fertility issues. It's often a lingering consequence of APM or just persistent contamination that wasn't fully cleared.
Right, it sticks around.
Then another important distinction is endometritis.
How is that different?
Well, endometritis is inflammation primarily of just the endometrium, which is the inner uterine lining.
Yeah.
It's often a chronic condition leading to persistent infertility. Now, postpartum metritis can lead to chronic endometritis, but the key distinction is that metritis involves deeper uterine layers,
A whole wall.
whole wall, potentially, whereas endometritis is limited to the lining. Think of it like a skin rash versus a deep tissue infection.
Got it.
Finally, there's pyometra. This is the accumulation of pus within the uterine lumen, essentially, a pocket of infection trapped inside. It's less common immediately postpartum, but can be a long-term complication if the mare's cervix doesn't open properly, preventing drainage.
Okay, that summary really clarifies the spectrum. You've got the sudden, severe whole uterus infection, the more lingering lining inflammation, and then this trapped pus situation.
Hmm.
This brings us to a crucial part. How do we actually recognize the signs? What does a veterinarian look for, and what should an owner be watching out for?
Right. When a vet is assessing a mare, they're looking for both systemic signs affecting the whole body and local signs in the reproductive tract. For acute puerperal metritis, the systemic signs are often quite severe. You're looking at a fever, usually over 101.5 Fahrenheit or 38.6 Celsius.
3 foot.
Depression, lethargy, and anorexia. The mare just looks unwell, off her feed.
Not eating.
You might also see tachycardia and tachypnea, elevated heart and respiratory rates. And signs of endotoxemia, where those toxins are causing systemic inflammation, are particularly alarming.
What does that look like?
Injected mucous membranes, the gums might look very red or even purplish, a prolonged capillary refill time, profuse sweating, and in severe cases, laminitis.
Oh, wow. Laminitis too.
Yes, and it's important to note that laminitis can appear anywhere from 12 hours to maybe 5 days postpartum. This makes early detection of the underlying metritis really critical. There might also be reduced milk production or even agalactia, a complete lack of milk.
So beyond those alarming whole body issues, there are local signs too, right? Present across the different forms.
Exactly. The most obvious is vaginal discharge.
Okay.
This can vary widely in amount, from scant to profuse.
And the appearance?
Its color might be reddish-brown, dark brown, gray, purulent, meaning pus-like or watery. But what's really telling, often a key indicator, is the odor. A foul smell frequently points towards anaerobic bacteria being involved.
That makes sense.
And the uterus itself, during a veterinary exam, can be palpably enlarged, might feel flaccid or sort of pendulous.
Loose.
Yeah, loose, and contain this fetid, thick, tan to maybe chocolate-colored fluid. You'll also see delayed or abnormal uterine involution. It's not shrinking back as it should.
Okay.
In severe cases, mares might even show signs of abdominal pain or colic.
And you mentioned conformation issues.
Right. Sometimes mares with poor vulvar conformation, where the lips of the vulva don't seal properly, can develop pneumovagina. Air gets sucked in.
Carrying contaminants.
Exactly. Allowing air and contamination to enter, which predisposes them to these ascending infections.
When might these signs start appearing?
It's worth noting that these signs, particularly things like depression, abdominal discomfort, and anorexia, can be evident quite early, maybe as early as 12 to 24 hours postpartum. So quick action is often key.
So with all these signs potentially pointing to metritis, how do veterinarians actually put the puzzle pieces together? How do they confirm a diagnosis? What's the diagnostic journey look like?
It really is a detective process. We start, as you might expect, with a detailed history and clinical examination.
Asking lots of questions.
Precisely. The vet will ask specific things about the foaling, the date, the type, duration of labor, any difficulties like dystocia, whether retained fetal membranes were present, and the mare's previous reproductive history, too. Oh, yes, that's crucial context. Then a general physical exam checks vital signs, hydration status, mucous membranes, looks for any signs of pain. Then comes a perineal exam to assess that vulvar conformation we talked about and the character of any discharge, followed by a vaginal examination, often using both a speculum and manual palpation, to assess the cervix, the vaginal walls, and the uterine lumen itself.
And that history, I imagine, is crucial. The details about the foaling itself.
Absolutely. It provides invaluable context. Following that initial assessment, transrectal palpation and ultrasonography are critical tools.
Feeling and looking inside.
Exactly. With palpation, the vet assesses uterine size, wall thickness, its consistency, whether there's fluid present, the degree of uterine involution, how much it shrunk back, and also the mare's pain response. Interestingly, a positive response to treatment often includes a palpably thickened, corrugated uterine wall.
Corrugated, like ridges.
Yeah, like ridges indicating it's contracting.
Right.
Whereas unresponsive mares tend to have flaccid, thin uterine walls and continue to accumulate fluid.
And the ultrasound.
Ultrasonography is considered the gold standard for fluid detection. It identifies fluid whether it's anechoic, appearing black, or hypoechoic, appearing grayish, clearly showing liquid within the uterus. It also helps assess uterine wall edema and thickness. And it can identify retained fetal membranes, which might appear as thickened, irregular areas in the uterine lumen with brighter hyperechoic structures.
Okay, so the ultrasound gives a really good visual.
A very good visual. Then there's uterine culture and sensitivity testing.
To find the bug and what kills it.
Exactly. The sample is collected carefully using a guarded uterine swab or maybe a low-volume uterine lavage. Ideally before any antibiotics are administered, so we get an accurate picture of what's there.
Makes sense.
This helps identify the specific causative bacteria. Common culprits are E. coli, Streptococcus equus sub FP, Zooepidemicus, Klebsiella pneumonia, Pseudomonas aeruginosa, and an important gram-positive anaerobe called Bacteroides fragilis. Sensitivity testing is then crucial to guide the selection of the most effective antibiotic.
But you have to interpret that carefully.
Yes, that's important. Large numbers of mixed bacteria are actually expected in normal, healthy, early postpartum mares. So interpretation needs care. It's about which bacteria are present, in what numbers, and alongside signs of inflammation.
So the sheer number of tools a vet uses highlights just how challenging a diagnosis can be. Out of all these, what's the one thing that gives the most immediate, critical insight in the field?
That's a good question. While culture and sensitivity are vital for guiding treatment, the combination of the clinical signs, the findings on transrectal palpation, and especially ultrasonography for fluid detection, that provides the immediate, critical insight for diagnosing metritis itself. Seeing that fluid in the uterus is a big red flag.
Okay, what else?
Well, there's cytology. This involves microscopic examination of uterine swab or lavage samples. We look for inflammatory cells, particularly neutrophils, a type of white blood cell, as well as bacteria and degenerate epithelial cells from the uterine lining.
And lots of neutrophils means infection.
A high neutrophil count, typically more than 2 neutrophils per high-power field on the microscope slide, seen together with bacteria, strongly suggests an active infection. Other diagnostics may be used as indicated, like a complete blood count, CBC.
Why might that show?
It might show leukopenia, low white blood cells with toxic changes in the white cells, or a left shift, meaning lots of immature white cells are being released, indicating a severe infection. Or it could show leukocytosis, which is high white blood cells. High fibrinogen levels, maybe over 500 milli-GDL, also indicate acute inflammation. Serum biochemistry helps evaluate systemic effects, like kidney function. And an endometrial biopsy might be performed for chronic cases, but not usually for the acute ones.
It's a complex picture, and veterinarians also have to consider differential diagnoses to rule out other things, right?
Absolutely. Things like normal postpartum lochia, that's the normal discharge after foaling, which should be odorless, dark red-brown, and usually gone within about 6 days. Or even more serious things like uterine tears. It truly highlights the need for experienced professional assessment.
So what does all this mean when it comes to treatment? The goal seems clear. Eliminate the infection, promote the uterus protruding to normal, and hopefully restore the mare's fertility. And you emphasized aggressive, multimodal therapy is often needed, especially for that acute puerperal metritis. Sounds like a multi-pronged attack is essential.
That's exactly right. The primary objective is the mechanical removal of all that inflammatory exudate, the bacteria and debris from the uterus, and we do that through uterine lavage or drainage.
Flushing it out.
Flushing it out. This involves infusing large volumes, sometimes liters of warm, sterile saline, or maybe a dilute antiseptic like povidone iodine or chlorhexidine until the fluid coming back out runs clear.
How often?
It might be done 1 to 3 times daily, depending on the severity. And there's a specific caution. If a uterine tear is suspected, much smaller volumes, maybe around 1 liter, are used very carefully to avoid making things worse.
Got it. Then antibiotics.
Yes, systemic antibiotics are key. Selection should ideally be based on those culture and sensitivity results we discussed.
But you start broad spectrum first.
Exactly, while waiting for results. Common initial choices often include penicillin, which is good for gram-positives like Streptococcus, combined with an aminoglycoside like gentamicin or amikacin. For gram-negatives, they work well together, synergistically. Other options include cephalosporins like ceftiofur. Trimethoprim sulfamethoxazole is an oral option that can be effective. And if we suspect anaerobic bacteria, remember the foul smell. Metronidazole is added.
How long is the course?
Treatment typically lasts 5 to 10 days, but sometimes longer, depending entirely on the mare's response.
You mentioned local or an intratum. Antibiotics are a bit controversial. Why is that?
They are, mainly because there's debate about how well they penetrate into the deeper uterine tissues where the infection might be lurking. And there's always the concern about contributing to antibiotic resistance developing within the uterus.
So when are they used?
They are sometimes used, often alongside systemic antibiotics, particularly for very severe cases or perhaps for milder cases of just endometritis. When used, water-soluble formulations like penicillin, gentamicin, or ceftiofur are generally preferred.
Makes sense. What about helping the uterus contract?
Yes, Ecbolics drugs that stimulate uterine contractions are vital.
Like oxytocin.
Exactly. Oxytocin stimulates uterine contractions, helping with drainage and involution, getting it to shrink back down. It seems most effective early postpartum, given at low doses, maybe 5 to 20 IU intramuscularly every 2 to 4 hours, or sometimes as a continuous infusion, like 40 IU in IV fluids.
Give me others.
Prostaglandins, specifically PGF2, are also potent uterine contractors. They can be particularly useful later postpartum to promote uterine clearance, and they can also induce estrus, which naturally helps the mare clean herself out.
And managing the inflammation itself.
Right. Anti-inflammatory medications are important. NSAIDs, non-steroidal anti-inflammatories like flunixin meglumine, commonly called Banamine, or phenylbutazone, Buta. They help reduce pain, fever, and inflammation, and crucially, they help counteract the effects of endotoxemia.
But no steroids.
Generally, no. Corticosteroids are usually not recommended because they suppress the immune system, which is the last thing you want when the mare is fighting a severe infection.
Okay. What if retained fetal membranes were the trigger?
If retained fetal membranes are present, management involves gentle manual removal if possible, uterine lavage, oxytocin to help expel them, and absolutely crucially, systemic antibiotics because the risk of severe metritis is very high in those cases.
And general support.
Yes, supportive care is essential, especially in severe cases. This might include IV fluids for dehydration or endotoxemia, nutritional support if she's not eating, and proactive laminitis prevention.
Laminitis prevention. How?
Things like deep bedding, supportive foot pads, and often prophylactic cryotherapy using ice boots to continuously cool the hooves and reduce inflammation down there.
Wow, a lot to manage. Are there side effects to worry about with these treatments?
Oh, absolutely. It's a balancing act. NSAIDs, for example, can cause gastric ulcers and kidney damage, especially if the mare is dehydrated. Aminoglycosides, like gentamicin, can be nephrotoxic, toxic to the kidneys, and also ototoxic, potentially affecting hearing or balance. So hydration must be excellent when they are used. Polymyxin B, sometimes used for endotoxemia, is also potentially nephrotoxic.
So kidney monitoring is key.
Definitely. And the combination of dehydration and NSAIDs can severely worsen the potential kidney toxicity of aminoglycosides and polymyxin B. And metronidazole, used for anaerobes, can sometimes decrease appetite, which might impact milk production in a postpartum mare, indirectly affecting the foal. These are all considerations veterinarians weigh very carefully.
Given all this intensive treatment, what's the outlook for mares with metritis? Is recovery common, or is it often a long uphill battle?
Well, the prognosis for survival is generally good for uncomplicated cases that are caught early and treated aggressively. However, it becomes guarded to poor for severe cases, especially if septicemia, endotoxemia, or laminitis develops. Those are very serious complications.
How do you know if it's going well?
A rapid and positive response to therapy, where the mare starts looking brighter, eating better, fever comes down quickly, usually indicates a favorable prognosis.
What about her future breeding prospects?
For future fertility, the prognosis is highly variable. It really depends heavily on the severity and duration of the infection, the extent of any permanent damage to the endometrium, that delicate uterine lining.
Right.
How promptly and effectively treatment was started, and whether irreversible changes like scarring have occurred within the uterus.
So mild cases might be okay.
Mares with mild, uncomplicated metritis that resolves quickly often return to normal fertility, but severe or chronic cases may face significantly reduced fertility or, sadly, even become permanently barren.
So follow-up is crucial before trying to breed again.
Absolutely essential. Monitoring and follow-up involve regular uterine exams, palpation, and ultrasound, and often repeat uterine culture and cytology to confirm the infection is completely cleared before any breeding attempts. If fertility issues persist, an endometrial biopsy might be needed to assess the level of long-term damage.
All of this knowledge about diagnosis, treatment, and prognosis naturally leads us to the absolute importance of prevention. What are the key strategies for horse owners and veterinarians to minimize the risk of this challenging condition?
Absolutely. Prevention is paramount. It really starts with meticulous peripartum management that's managing the period around foaling.
What does that involve?
This means maintaining a clean foaling environment, strict aseptic technique if assisted foaling is necessary, and importantly, making sure it's performed only by experienced personnel. Close observation of mares during and especially after foaling is key. And critically, it's about ensuring the complete expulsion of the fetal membranes, the placenta, ideally within 3 hours postpartum.
And if they're not expelled?
Then intervention with oxytocin or perhaps uterine lavage should be considered without excessive delay to help prevent problems from starting. Other preventative measures include maintaining good biosecurity on the farm to limit exposure to pathogens, optimizing the mare's nutrition and overall body condition before, during, and after pregnancy is also important for her immune system, and conducting pre-breeding evaluations to identify and address any existing reproductive issues before she even gets pregnant can prevent problems down the line.
This deep dive has truly given us a comprehensive understanding of equine postpartum metritis. We've covered its varied causes, the different classifications, the intricate diagnostic journey, the multimodal treatment strategies, and that critical importance of prevention. It's really valuable knowledge for anyone involved with or simply fascinated by these magnificent animals, offering concrete insights into protecting their well-being after foaling.
Absolutely. And if we connect this to the bigger picture, maybe looking forward, what might the future hold for managing these critical conditions, especially as we grapple with increasing challenges like antibiotic resistance? Could cutting-edge therapies, maybe things like stem cells to help uterine repair, or perhaps deeper insights into the mare's own immune response, could that unlock new strategies? Or even understanding the complex role of bacterial biofilms, those slimy protective communities bacteria form that make them harder to treat, could understanding those better lead to new ways to tackle these chronic, hard-to-treat infections? Lots to think about.